Are you curious about the uses and benefits of escitalopram? In this comprehensive guide, we will walk you through the typical applications, benefits, potential side effects, dosage recommendations, and risks associated with escitalopram. Escitalopram is a medication commonly prescribed to treat major depressive disorder, generalized anxiety disorder, and other mental health conditions. As a selective serotonin reuptake inhibitor, SSRI, it works by increasing the levels of serotonin in the brain, which can help alleviate symptoms of depression and anxiety. One of the key advantages of escitalopram is its effectiveness in reducing the symptoms of these conditions. Research has shown that it can help improve mood, reduce feelings of sadness and worry, and enhance overall well-being. However, as with any medication, there are potential side effects to be aware of, such as nausea, fatigue, and sexual dysfunction. Dosage recommendations will depend on the individual's condition and severity, and it's crucial to follow the guidance of a healthcare professional. Additionally, it's important to understand the potential risks associated with escitalopram, including the potential for suicidal thoughts in some individuals, especially during the initial stages of treatment. Join us as we dive deeper into the world of escitalopram and gain a better understanding of its uses, benefits, and risks. Understanding the typical applications of escitalopram. Escitalopram is primarily used to treat major depressive disorder, MDD, and generalized anxiety disorder, GAD. These conditions can have a significant impact on an individual's daily life, making it difficult to function normally. Escitalopram helps by increasing serotonin levels in the brain, which can improve mood, reduce sadness, and alleviate anxiety. In addition to MDD and GAD, escitalopram may also be prescribed for other mental health conditions, such as panic disorder, social anxiety disorder, and obsessive-compulsive disorder. However, it's important to note that the effectiveness of escitalopram may vary depending on the specific condition and individual response. When prescribed for MDD, escitalopram is often used as part of a comprehensive treatment plan that may include therapy and lifestyle changes. It can help individuals regain a sense of well-being and improve their quality of life. In the case of GAD, escitalopram can help reduce excessive worrying and promote a calmer state of mind. Overall, escitalopram is a versatile medication that has proven to be effective in treating various mental health conditions. However, it's essential to consult with a healthcare professional to determine whether it is the right choice for your specific needs. Exploring the benefits of escitalopram. Escitalopram offers several benefits for individuals struggling with mental health conditions. Its primary advantage is its ability to alleviate symptoms of depression and anxiety, allowing individuals to regain a sense of normalcy in their lives. For those with major depressive disorder, escitalopram can help improve mood, increase energy levels, and restore interest in previously enjoyed activities. It can also reduce feelings of guilt, hopelessness, and worthlessness that often accompany depression. In the case of generalized anxiety disorder, escitalopram can help individuals manage excessive worrying and reduce the physical symptoms associated with anxiety, such as restlessness and muscle tension. It can also improve sleep quality, which is often affected by anxiety. Another benefit of escitalopram is its relatively fast onset of action. Many individuals report feeling improvements in their symptoms within weeks of starting treatment. This quick response can provide much-needed relief for those suffering from depression or anxiety. However, it's important to note that the benefits of escitalopram may vary from person to person. Some individuals may experience significant improvements, while others may not respond as well. It's crucial to work closely with a healthcare professional to monitor progress and adjust the treatment plan if necessary. Potential side effects of escitalopram. Like any medication, escitalopram can have potential side effects. It's essential to be aware of these possible effects and discuss them with a healthcare professional before starting treatment. Common side effects of escitalopram may include nausea, dry mouth, drowsiness, and sexual dysfunction. These side effects are usually mild and transient, often improving as the body adjusts to the medication. However, if these effects persist or become bothersome, it's important to inform your healthcare provider. In some cases, escitalopram may cause more severe side effects that require immediate medical attention. These can include allergic reactions, serotonin syndrome, a potentially life-threatening condition characterized by agitation, hallucinations, rapid heart rate, and high body temperature, and suicidal thoughts or behaviors. It's crucial to seek medical help if any of these symptoms occur. It's important to remember that not everyone will experience side effects from escitalopram, and the benefits of the medication often outweigh the risks. However, it's essential to discuss any concerns or questions with a healthcare professional to ensure the best possible outcome. Dosage recommendations for escitalopram. The appropriate dosage of escitalopram will depend on several factors, including the individual's condition, severity of symptoms, and response to the medication. It's important to follow the guidance of a healthcare professional when determining the right dosage for you. In general, the starting dose of escitalopram for adults is usually 10 mg per day, taken orally. This can be adjusted based on individual response and tolerability, with a maximum recommended dose of 20 mg per day. For elderly individuals or those with liver or kidney impairment, lower doses may be prescribed. It's important to take escitalopram as prescribed and not to exceed the recommended dosage. Abruptly stopping the medication can lead to withdrawal symptoms, so it's crucial to consult with a healthcare professional before making any changes to the treatment plan. It may take several weeks for escitalopram to reach its full therapeutic effect, so it's important to be patient and continue taking the medication as directed. If you have any concerns or questions about the dosage or treatment duration, it's best to consult with a healthcare professional. Risks associated with escitalopram usage. While escitalopram can be an effective treatment option for many individuals, it's important to be aware of the potential risks associated with its usage. One of the main concerns with escitalopram is the potential for increased suicidal thoughts or behaviors, especially in children, adolescents, and young adults. This risk may be higher during the initial stages of treatment or when adjusting the dosage. It's crucial to closely monitor individuals taking escitalopram for any changes in mood or behavior and seek medical help if necessary. Another risk associated with escitalopram is the potential for serotonin syndrome, a rare but potentially life-threatening condition. Serotonin syndrome occurs when there is an excessive amount of serotonin in the brain, leading to a range of symptoms, including agitation, hallucinations, rapid heart rate, and high body temperature. If any of these symptoms occur, medical attention should be sought immediately. It's important to discuss any pre-existing medical conditions, medications, or supplements with a healthcare professional before starting escitalopram to ensure there are no contraindications or increased risks. Tips for using escitalopram effectively. To maximize the effectiveness of escitalopram and minimize potential risks, there are several tips to keep in mind. Follow the prescribed dosage. Take escitalopram as directed by a healthcare professional and do not exceed the recommended dose. If you have any concerns or questions about the dosage, consult with your healthcare provider. Be patient. It may take several weeks for escitalopram to reach its full therapeutic effect. Stick with the treatment plan and give the medication time to work. Communicate with your healthcare provider. If you have any concerns, questions, or experience any side effects, it's important to discuss them with your healthcare provider. They can provide guidance and make any necessary adjustments to your treatment plan. Attend regular checkups. Regularly scheduled appointments with your healthcare provider are essential to monitor your progress and make any necessary adjustments to your treatment plan. Do not abruptly stop taking escitalopram. If you wish to discontinue escitalopram, it's important to consult with your healthcare provider. They can provide guidance on gradually tapering off the medication to minimize withdrawal symptoms. Remember, everyone's experience with escitalopram may be different, and it's important to work closely with a healthcare professional to ensure the best possible outcome. Frequently asked questions about escitalopram. Is escitalopram addictive? Escitalopram is not considered addictive, and withdrawal symptoms are rare. However, it's important to consult with a healthcare professional before making any changes to the treatment plan. Can escitalopram be used during pregnancy? It's crucial to discuss the potential risks and benefits of using escitalopram during pregnancy with a healthcare professional. They can provide guidance based on your specific situation. How long does it take for escitalopram to work? It may take several weeks for escitalopram to reach its full therapeutic effect. However, some individuals may start to notice improvements in their symptoms within a few weeks. Can escitalopram be taken with other medications? It's important to discuss all medications, including over-the-counter drugs and supplements, with a healthcare professional before starting escitalopram. They can provide guidance on potential interactions and adjust your treatment plan accordingly. Can escitalopram be used in children? Escitalopram may be prescribed to children and adolescents for certain mental health conditions. However, it's crucial to consult with a healthcare professional to determine whether it is the appropriate treatment option for the child. Alternatives to escitalopram. While escitalopram is a commonly prescribed medication for depression and anxiety, there are alternative treatment options available. These can include other SSRIs, such as sertraline or fluoxetine, as well as other classes of antidepressant medications, such as serotonin norepinephrine reuptake inhibitors, SNRIs, or atypical antidepressants. It's important to discuss these alternatives with a healthcare professional to determine the most suitable option for your specific needs. Conclusion: Escitalopram is a valuable medication used to treat major depressive disorder, generalized anxiety disorder, and other mental health conditions. Its ability to increase serotonin levels in the brain can help alleviate symptoms and improve overall well-being. While escitalopram offers significant benefits, it's important to be aware of potential side effects, follow dosage recommendations, and understand the associated risks. If you are considering escitalopram as a treatment option, consult with a healthcare professional who can provide personalized guidance and support throughout your journey. Remember, mental health is important, and seeking appropriate treatment can make a significant difference in your well-being.